You're listening to the voice of Nassau Community College, 90.3 WHPC. My name is Bill McIntyre, and it's time for this week's Long Island News, the show that talks to newsmakers and other important people from Nassau and Suffolk County that matter to Long Island and Long Islanders like you. So each week we'll have a conversation about issues that affect all of us. I live on Long Island just like you, and I want to know more about the people making the big decisions that affect all of us. Well, this week, we're going to dig a little deeper on the topic of healthcare and talk about the rising costs, what insurance covers and doesn't cover, the latest with Medicare and Medicaid, and other health issues that have been in the news lately. And I want to welcome my guest today, Nick Stefannizi, the CEO of Northwell Direct, to hopefully shed some light on how Northwell is navigating the political landscape and the legal hurdles involved. Welcome to this week's Long Island News.
Thanks for having me, Bill. It's a pleasure.
So let's start out with, tell us a little bit about you, your background in healthcare and administration.
So I've had the privilege of working in healthcare, and I say that very deliberately. It's a privilege to work in healthcare and to get up every day and think about, how do we help people? How do we help people get better? How do we help people stay well? But I've had the privilege for working in healthcare for the last 15 years, all of which have been part of the Northwell Health system. Started my career in technology. I spent time in operations as well as in human capital. And for the last 4 years, have served as the CEO of Northwell Direct, which is Northwell Health's direct-to-employer business that focuses on partnering with businesses in the community, helping them find access to high-quality healthcare at a lower price point for their employees and the family members of those employees.
Right. It's an interesting thing that you brought up is why? Well, I think I know why. It's just that it's been this way for so long that our healthcare has always been tied to our employer. And sadly, it hasn't been used to the benefit of the employee. It's been used to twist their arm to get them to do things that, I can't quit my job. I won't have health care. And one of the main absurdities of that whole situation is COBRA. You've just been released from your job and someone approaches you with a piece of paper that says, well, don't worry about your insurance. You can get COBRA. And then when you look at the price tag, you're not sure if they realize you just lost your job. It's not that you just got one. I mean, some of these price tags are $8,000, $9,000 a month. That's ludicrous. How did anybody with a straight face ever do that to an employee?
It's, our system, the architecture of our system here for financing healthcare delivery is incredibly complex and is different from pretty much any other country out there.
Well, don't go there.
I'm not suggesting that's a bad thing. I'm just suggesting it's right. Very different. And
well, I was going to say the reason it's different is because they have universal health care and we don't.
That's
so
right.
There's a major difference right there.
Major difference. Now, what is interesting is, as a result of the way insurance developed, the concept of insurance developed over decades, is you're exactly right. In our country, insurance, 50% of citizens in the United States have access to health insurance. That's 155 million people in this country have access to health insurance coverage through an employer-sponsored plan. Right. And what has happened in a lot of ways is we've lost the concept of who really pays for healthcare. We think of and we talk about insurance companies as the payers of care. The reality is employers and the individuals that work for them are the true payers of care, and the insurance companies have shoved themselves in between the payers and the providers. And what we're trying to do at Northwell Direct, what my team I spend all day, every day doing is saying, we've got to think differently about this. We've got to get these insurance companies out of the middle of the equation and create relationships directly between providers and employers and their employees. In doing so, we can reduce costs. We can provide more customized care. And we can sort of fundamentally transform how we organize, deliver, and pay for care. So I agree it's a problem.
You picked quite an adversary.
Well,
I mean, you didn't pick him. He's there. So,
this is the reality of the situation we're in. And I think what we see and what we hear every day is that employers are really struggling. They are really struggling with how much it costs to provide care for their employees. And they all recognize that in order to recruit and retain the kind of talent that they need to move their organizations forward, this is an important investment. And by the way, it's usually the number 2 or 3 item in any company's budget.
Right.
But what's happened over the last decade is what they see year in, year out is a double-digit increase in the cost for their insurance. And employers have just reached a point where they're saying this isn't sustainable. We've got to do something different, and they're really struggling. And so, they're demanding and looking for something different. And at the same time, Northwell as a provider organization is saying, we think there's a better way. So did we pick that adversary? Maybe, but I think the market is saying we need something different, and we see an opportunity as a provider organization to be part of the solution.
Yeah, but I mean, their stock in insurance's stock in trade is being the middleman. Mm-hmm. Yeah. How are you going to tell? Listen, tomorrow's a new day, and you guys, you have to go somewhere else.
There's a reason there's that old adage, or like the most tried and true business strategy. Cutting out the middleman. It's not a new concept.
Yeah, no.
How do you do it? Look, to me, this is an evolution, not a revolution process.
Yeah, right. It's not going to happen in one day.
It's not going to happen in one day. But we've got 30 employers in the New York metro area who have said, we're interested in this and we want to give it a try. Right. They represent, including Northwell, 100,000 employees and family members in our service areas.
It would be a good test group. It would be
something.
Yeah. Well, okay. So now you said too what Northwell Direct is. Give us a little more on that. Is it computer generated? I mean, you do. Will people go online, or is this strictly for companies? You're strictly, talking.
So the work that we do is focused on employers and their team members, and so we've created an alternative to the traditional models for employer-sponsored healthcare insurance. Mm-hmm. And again, we serve 30 employers that way, representing 100,000 members here in the New York metro area. We also have clinical services that we deploy in the office or virtually for an employer's team members. And that includes everything from on-site clinical services, vaccinations, but it also includes innovative models for areas like behavioral health, primary care, virtual care. Mm-hmm. What we really focus on is understanding what an employer's population really needs, right. And then figuring out the best way to deploy it and make it accessible to them.
Now, I understand the idea of making services available to employees, but we get into some situations here where employees are invited into some kind of program or whatever, and there are negative side effects for saying no. I don't want to be on your volleyball team. I don't want to exercise with my coworkers at 5:00. I want to go home. Mm-hmm. Because being that the health insurance is tied to your company and being people, how people are, they will use it as a tool to manipulate their employees and getting them to do what they want to do. It's like with the, just in general medical care. It's one thing to go to a doctor. You're sick. Okay, you want to go to a doctor. It's another thing to have somebody call you and say, it's May and you should be taking this little red pill for something down the road that hasn't even occurred yet that you don't even know you have. And maybe you don't. That's the kind of iffy thing that I have with this idea of healthcare being tied to these companies. Individuals ought to be able to manage their own healthcare without interference from the people they work for.
Yeah, I think that's there's really something to the idea of the individual being able to own and drive their decisions about healthcare. And what we try to do in our work is create access and to make it to give individuals the tools to help them effectively own and manage their health and their well-being journey.
Right.
And so, as an example, we work with, we do a tremendous amount of work for individuals with diabetes, major chronic condition in the U.S. And our whole philosophy is, let's give you the tools. You use the tools if you'd like. Right. And we're here to support you along your journey to manage your diabetes. But you've got to take the initiative. You've got to want to do it. Because let's face it.
That's true.
If you don't want to do it, if you're not resolved that you're going to make a change, whether it's behavioral, lifestyle, diet, whatever it may be, it's not going to work. Mm-hmm. It's not going to work. So our whole philosophy is, we'll give you the tools, we'll give you the support to meet you where you are when you're ready.
Yeah, you can lead a horse to water, but you can't make him drink. Yeah. You're listening to this week's Long Island News on the voice of Nassau Community College, 90.3 WHPC. My name is Bill McIntyre, and my guest today is Nick Stefannizi, the CEO of Northwell Direct. Now, some history, right? President Biden and Senator Bernie Sanders are excited about the lower health care costs that come through the Democrats' sweeping package that Biden signed into law in 2022. Now, it caps various health care costs for those on Medicare, including $35 a month for insulin and $2,000 a year for prescription drugs. None of the Republicans voted for it. What's making these drugs and other various health care services so expensive? The interesting thing with the way this is written, though, there's a $35 a month cap. Is that the government telling Medicare that's all you're going to pay a hospital for treatment, or is that telling the hospital that's all you can charge?
I think what it's doing is offering a great financial protection for those that are on Medicare. Yeah. And the notion that paying for prescriptions could put people that are of age and eligible for Medicare into financial hardship. I mean, just wrapping your head around that is really difficult. Yeah. And so I think it's a terrific financial protection. I think what it does is set the price that the government will pay, and thereby that can be expected for those drugs to be dispensed for those individuals. Yeah. And it does it through law. And it's the first time that the federal government has negotiated directly drug prices, which is not something historically, and that's different again in our country compared to many others. Yeah. Our government has not historically, and I think taking this first step has offered a great initial financial protection. I'm hopeful and optimistic for those that participate in Medicare, that there'll be more that follows, and that hopefully this can have a ripple effect beyond even just the Medicare population, because the cost of drugs is on the rise. Yeah.
Medicare it's always bothered me. Medicare is supposed to be for old folks, pretty much, right? I mean, that's, and yet it doesn't cover glasses. It doesn't cover hearing aids, and it doesn't cover teeth. Mm-hmm. Three of the things that that every elder person is going to eventually need. Mm-hmm. So the three basics, and it doesn't cover those.
Yeah, I think it's sort of interesting how that law has evolved. And I think certainly as life expectancy and other things have grown and evolved since the inception of those programs, and even technologies have evolved, we've had to, through legislation, try to go back and correct and amend and augment what has existed. And we all know how difficult it is to expect that, we'll get meaningful substantive legislation passed these days.
It might take 12 tries.
That's right. Yeah, but I think that's why you've seen the rise of things like Medicare supplement plans. I think that's why you've seen Medicare Advantage plans that are administered through the insurance carriers that cover a broad range of services. I think that's why we've seen an increase in popularity, because they're a vehicle to get at some of those things. And I would just say, I agree with your point. Dental care, the correlation between dental health and your broader health and well-being is something that does not get enough attention. Yeah. And I'm hopeful that will become an increasing focus for us as we go forward.
Yeah. No, it is big. It is big. Now, what are some of the services that would not be covered by any insurance if I were walking to an ER, for example? What would I automatically have to pay out of pocket for?
Yeah, and unfortunately, this is one of those questions where the answer is it depends.
Right.
It depends on your plan. I think, general sort of high level, what I would say, if you're walking into an ER and you're not in an emergent situation that requires emergency services,
right.
It's likely that your plan will have some limitation on how much the plan will cover versus what an individual would be responsible for.
That's not likely. That's straight across the board. Everyone
Correct.
walks in, say, I have insurance, and somebody says, yeah, but what exactly does that mean?
Yeah.
You have a piece of paper on your kitchen table that says you paid somebody to cover you. But when you get there,
I think it's such a good point. We get, and people should have a sense of security that they carry that insurance card, that if something bad happens to them or their family member, they're going to be protected. I think what we don't do a good enough job of is really helping to educate people about the nuance of those plans.
Yeah, definitely.
What's covered. What are the splits between what plan pays and what the individual is responsible for? What is your copay? What's your deductible? What's your co-insurance? What does that all mean?
Right.
And how do you calculate it? We do not do a good enough job educating, and we as the consumers of healthcare don't do a good enough job seeking out the information, right? How many people do you think the annual open enrollment window are spending the time going through the benefits brochure?
I agree with you, but I will also say that my experience has told me doctors' offices and, how many people they ask all the time, are you in my network? And they get told, yes, you're covered, don't worry. And then the procedure happens and they get a bill for $2,000 that they had well, that's definitely not one of the things. You should have known that. It's up to us to figure out what we're covered by. Why is that not part of the doctor's offices, to tell us, yes, you are. And they should have to sign a piece of paper that they told us it was covered. So that, because these things are going through the net. They're falling by the wayside. You do realize, it's more than 60% of the foreclosures on Long Island are due to medical bills.
Which is tragic.
How is, and yet I certainly don't hear medical people talking about that. I hear the populists talking about it. We have a new medical breakthrough. So we spend our time, patting ourselves on the back for something that you and I aren't going to see in our lifetime. And it's a great thing. Hey, they came out with a new. Meanwhile, I'm getting hammered. Mm-hmm. And it's not even out of the ordinary medical treatment, regular stuff. There have been some instances of people getting bills. I know somebody personally that got billed for $90,000 from a doctor they didn't even know. Mm-hmm. But while the procedure was going on, apparently the door opened and someone stuck their head in. Mm. Obviously, that's probably the outlier in the statistical analysis, but it's occurring. And
I believe that's really the heart of what the transparency and no surprises laws were intended to curb those practices and prevent individuals from being impacted without their knowledge. Because the idea again of a bankruptcy or foreclosure due to an unforeseen medical event is just tragic.
It is,
and look, I'll just go back to the work that we're doing through Northwell Direct with employers. What we see on average is that our approach, partnering directly, employers can save up to 20% on average through the efficiencies that we're able to deliver. We encourage them we encourage them to pass those savings on to their employees through lower copays, lower deductibles,
Right.
so that the individual shares in that benefit.
Yeah. Do they constantly stay in touch with you as far as, well, I have a question about how would we do this? And, I mean, that's a great thing, I think, for you to be there for those companies when they have those. But the average guy doesn't have that person. And if you call, and I'm only going to use Northwell Health because that's who we're talking, but if I call Northwell Health and I get Bob the first time and he tells me something, and then a day later I call somebody, another number, and I get Fred and he tells me something different, it almost seems as though, well, we talk about stress in modern day life, and people looking for healthcare are more stressed than anybody else. It's worse than worrying about your cholesterol numbers, which I think is a whole nother boondoggle. But, now here's a question. I had somebody ask me this the other day because they've been treated for high blood pressure. Who in the healthcare situation is responsible for making sure that X-ray machines, blood pressure machines, and all of these have been calibrated? I understand it's an expensive thing to do, so doctors' offices and sites are not all that ready to do it in a timely fashion.
Oh, we have, I can't speak outside of Northwell. I'll talk about what we do. We have a robust biomedical engineering team within the health system that is responsible across all of our facilities, all of our provider offices for doing preventative maintenance,
right,
and for calibration on any piece of equipment that touches a patient. There is a schedule across all of those facilities based on the specific devices and technology, and it is maintained by our skilled biomedical engineering workforce. And I agree with you. You talk about something that is touching a patient, that is supporting diagnostic evaluation and clinical decision making. It is critically important that we make sure those things are absolutely maintained.
Yeah, the first thing that comes to mind is X-ray machines, because if nobody's looking at how many REMs you're getting, we got a great picture. 3 weeks later, the patient's hair is falling out. But I know that when you walk into an elevator in New York City, you can look at when the last time was inspected and by who, and all of that stuff. But we don't ask. We go to a dentist, they bring the machine out, they put that up against your head and start shooting pictures, and you've got a lead apron on, and you feel safe. But,
and I think people should be able to have a reasonable expectation of safety, and that those things are being maintained. And I think, again, I could speak for at least our organization. I think we have the kind of brand and reputation that people should know when they come into one of our facilities. It's going to be safe. They're going to be treated with a dignity and a humanity, and that we're going to do the best we can to make sure they have the best possible outcome.
Listening to you, I believe you, but the one thing that I know it'll be is expensive, no matter what it is. No matter what it is. The companies, the doctors do try to work. They obviously try to work with the insurers, but I think the population on a whole is more nervous about their insurance not being what they thought it was when they walk into that office. And there doesn't seem to really be, there isn't one person in any given facility that says, I can give you a definitive answer that, yes, we're in your network. Yes, because so many people have gotten those assurances, and then they come back on and they go home and they're getting a bill, and and they're flipping out. I think it could be avoided. I don't think anybody's trying to pull a fast one. But it just seems to be the way it is, and we're the last ones to know.
Yeah, I hear you. I think for any of the members that we serve, we spend a lot of time educating our provider organization, educating the front desk staff.
Bingo.
Educating the people that answer the phone when you make an appointment. We spend a lot of time educating them on here's what the card looks like. Here's what it means when they say they've got coverage from X, Y, or Z. And that's one piece of it. The other side, because this is, look, it's a very human interaction. So you got to be educating, you got to be engaging, you got to be reminding. And then what we've worked to do is say, what can we do from a technology perspective to support those people who are interacting with the patients? How can we use our systems to make it easy for them to get the right answer and deliver it to the patient?
Here's another good thing, because I know somebody that just ran into this. They want them to create a portal. We're going to send you. So now this person's feeling is that, well, if I don't create a portal, that's one less opportunity for somebody to steal my information. Now, it's probably a misnomer. If they're going to steal your information, they're going to get it somewhere else. Now, don't worry about it being you. But in your head, when you're somebody that knows, a little information can really, so they feel it. Well, if I set up this portal now, there's going to be a way for people can steal my stuff. And
we have to be vigilant. We have to be vigilant as individuals to protect our personal information. How often do you get the fraud alert on the credit card, or you see these phishing and other types of emails and text messages now that come across? So I think people are right to be vigilant. I think there is a real value and a real benefit to some of these technologies and the ability to interact with your provider directly, electronically, and also to have access to your clinical information, which is so powerful. And what I would tell you is we have invested tens of millions of dollars as an organization into ensuring that the tools that we are putting into the hands of our patients and our providers are safe and protected. Because the threat around cybersecurity is real. It's something we take incredibly seriously to make sure we're doing all we can to protect our patients.
Yeah. Well, thank you for that. I know it's like it's a constant battle. You get one thing good, and then somebody figures out now you got to. In any event, we could go on. I have a million other questions for you. So one thing you got to do is promise me you'll come back and. We'll talk some more about things in the news and things that are going on with Northwell, because Northwell's a big deal on Long Island. You serve.
I appreciate that, and I would be happy to come back. And what I would just say to you is, Northwell and Northwell Direct are absolutely committed to Long Island. We see ourselves as part of the community, and our hope, our desire, our focus every day is on how do we raise the health of all the community members that we serve. So happy to come back and talk about the work we're doing there, or anything else you'd like to about healthcare.
Great. Thank you very much. And again, my guest today has been Nick Stefannizi, the CEO of Northwell Direct. And again, thank you for taking the time to talk to us here. I know you're busy. But here we go. The clock on the wall says it's time for this week's Long Island News to get on out of here. I'm Bill McIntyre. Remember, you can listen to us by searching for this week's Long Island News wherever you listen to podcasts. And we're right here every Friday, right on the radio at 3 p.m. on the voice of Nassau Community College, 90.3 WHPC.